And so in the area of where somebody has been out of work for a period of time, in your experience, in terms of reintegration and rehabilitation back into the workforce, what have you seen as being the most successful approach from employers?
Okay. Well, there are various different things. It depends to a certain extent on the nature of the work.
Yeah.
But there are various different tools employers should use. If an individual has been out for a short term, by a short term we'll say less than 3 months, then usually returning to work straight away is fine. In other words, they don't need a graduated reintroduction to workplace if it's less than 3 months. But if they've been out for over 3 months, they've lost the run of things in the workplace, they've lost mental stamina for whatever reason, they've been out sick, and they've lost the ability to work. And so a graduated reintroduction always works. So in other words, slowly build up the hours over a couple of weeks, sometimes 3-4 weeks, depending on how long they've been out, and that's useful. The other things that are useful is get them assessed in advance, exactly what the nature of the problem is. Get an independent person to examine them and say, okay, look, this is not likely to occur again, this was a one-off, or this is likely to occur again, this is what you'll need to do to stop this recurring again. Or Joseph has had this particular illness, he is fit to go back to work, but I'll put some restrictions or modifications to his role going forward because of he's had a stroke or he's got a heart problem, he really shouldn't be climbing ladders in the future, that sort of stuff.
Paul, assuming an individual develops into a long-term absentee, how best should an employer and the insurance company engage and manage that employee over time? Yeah,
that's a good question. Well, there are two things. The employee and the insurance company may manage it slightly differently. The employer first. The employer wants to know how long the employee is going to be out sick, because they need to have replacement staff, they need to know, is this person ever coming back to work? So they have knowledge that they need to have, which they won't get from the insurer. Because the insurer is not allowed to disclose anything they get concerning the employee. So let's look at the employer first. The employer really should employ, or if they already have, an occupational physician to assess their employee. And that's how they best engage. They contact them by phone and say, look, according to our protocols, you've been out for X, Y or Z period of time, it's time you get assessed. So they get an independent assessment with an occupational physician who will tell them, look, this is the story, this is the prognosis, he's never going to get back to work, he will get back to work in a year, he may be able to do his own work, he may not. And they have knowledge. And that's perhaps more important for the employer. They know what they're dealing with, and they have made contact with their employee. From an insurer, it's slightly different, because the insurer will have obtained information about them already, and their aim will be, can they get this individual back to work? So they will have them assessed independently by various different specialists according to whatever the nature of the disability is. And their aim is not so much, well, it would be great to get them back to work, but they're aiming to determine, is this person meeting a particular level of disability so that they get paid.
This is in the area of musculoskeletal, which in certain industries it would be one of the higher reasons why people are actually absent from work. In terms of the treatments of those, what are you seeing as being the most successful treatments in that area?
Okay, well, when you come to back pain, as the common, the ubiquitous back pain, about 95% of back pain is what we call simple back pain, and about 5% is more complicated. Either be it that it needs surgery, or it is, by its nature of the pain, it's a high risk. But 95%, most people with back pain have what we call simple back pain. And if people can be advised straight off from the start that back pain is common, it's a nuisance, it's not serious, it's not going to kill you, and it won't make you disabled, then that makes a huge difference. One of the greatest problems people feel with back pain is they get back pain and think, I'm done, my working days are numbered, and they have these fixed false beliefs about their future and their impending doom because of their back problem. They're never going to be able to work again, never going to be able to play golf again, and it's trying to break that and break it early is very, very important. So for example, we know that in the management of simple back pain, there are several old wives treatments out there that are actually bad. Lying down with a board under your bed, bad news.
Okay.
Wearing lumbar support, bad news.
Okay.
Resting for prolonged periods, bad news.
Okay.
So people with simple back pain must be encouraged to stay active, get mobile, stay as active as they can, and get back to work early. And those that do better.
Okay. So I suppose actions in terms of that on education maybe
Education programs
sometimes from a
hugely
prevention point of view, if somebody has an issue, maybe just at a very early stage or at a minor stage, where employers and the insurance companies can educate the individuals how to actually deal with it.
Even down to running a healthy back seminar
Yeah.
for a workforce, particularly if you've got a lot of workers who do a lot of manual handling.
Yeah.
Really, and it's just education. Getting a good physiotherapist, not even a part of a manual handling training program, but just if you get back pain, this is what you do.
These are the steps.
It's common. These are the worrying symptoms with back pain. Anybody else, don't worry.
Yeah.
It's a nuisance. Get over it.
No. Okay, and in the whole area of just in a general, in terms of exercise, and I suppose how employers can actually, how much influence they can have on their employees in terms of encouraging mental health and encouraging some exercise. And what have you seen in that area?
Okay. Well, generally speaking, you see, and it's hard to put numbers on this because it's obviously the insurance industry, but in general terms, we see less claims from companies that are paternalistic. In other words, they take an interest in their employee.
Okay.
And if they're the sort of company that run steps programs, where you exercise a day, where they do non-smoking programs, where they have various other health-related initiatives, if they're the sort of company who phone up people when they're sick to make sure they're okay and check on them and so on, and who use EAPs. In general terms, most underwriters, when they're looking to take on a company like that, they like them because their claims rates are less.
Okay, yeah, and it's also shown, I suppose, that the interests of the insurance company and the employer are somewhat aligned.
Coincide.
Okay. Okay, so just to summarise, I suppose, in terms of best practice, I suppose from employers' point of view, in terms of an absence management strategy, you mentioned about early intervention.
Early intervention, record absence, return to work interviews, get them assessed independently if they've been out sick for a prolonged period of time. And perhaps even more importantly than that, it's very important that your rules are clearly laid out and that the employees know in advance what the rules are.
Yeah.
And don't change them. Have them set in stone and say, okay, you can bend it maybe slightly one way or the other, but have it clear so that an individual doesn't feel like they're being isolated, treated differently than everybody else. This is the way we do it. It makes things work much more smoothly.
Perfect. Thank you, Paul.